Welcome to the 2024 Maria and Sam Miller Nursing Excellence Award Ceremony.
Good evening. It is my honor to welcome you to the annual Nursing Excellence Award Ceremony. Cleveland Clinic nurses are called to care and inspired to lead. Every day, you make a difference in the lives of our patients. Tonight's awards are the highest recognition we present to you. They celebrate those who exceed expectations and fully demonstrate what it means to be a Cleveland Clinic nurse. During the program, you will hear examples of nurses who represent all aspects of our mission. Each honoree is recognized for their dedication, compassion, and commitment to improving the delivery of care. We also take this moment to express our deepest gratitude to Maria Miller and her late husband, Sam. Their generous philanthropy is what made this program possible. Congratulations to all the award recipients. You are the embodiment of nursing excellence. Thank you for everything that you do. Now, I would like to introduce Meredith Fox, Senior Vice President and Chief Nursing Officer at Cleveland Clinic.
Thank you, Dr. Mihailovich. Your unwavering support of nurses and their contributions to healthcare is always appreciated. As our President and CEO shared, this is a celebration of the very best in nursing. To Cleveland Clinic nurses, it is the highest honor bestowed. Each nurse who receives an Excellence Award was nominated by a fellow caregiver or colleague or by a patient. Those who gave nominations had the opportunity to experience or witness the nurse's extraordinary practice, their empathy, compassion, and integrity, and their determination to go above and beyond in the care they provide. They have seen or felt the honorees' passion for the nursing profession and undeniable commitment to our patients, our caregiver family, our organization, and our communities. More than 650 award nominations were submitted for consideration, and we are proud to recognize 185 recipients throughout our health system this year. However, this ceremony belongs to an elite group of 41 nurses who are receiving our most prestigious enterprise recognitions. At Cleveland Clinic, we are fortunate to have a talented nursing team that includes nearly 35,000 global nursing caregivers. 11 of our hospitals hold the Distinguished Magnet designation from the American Nurses Credentialing Center, which is the highest recognition of excellence for a nursing facility. Every day, our nurses positively affect the lives of others through the evidence-based, high-quality care they provide patients and their families. These 41 honorees have stood out amongst their peers. They have embraced their profession to the fullest and are indispensable members of our caregiving teams. I consider it an honor to work alongside them, and I look forward to sharing their stories with you as we celebrate their success. Our program begins with a tribute to Mrs. Maria Miller and her late husband, Mr. Sam Miller. In 2012, they endowed the Nursing Excellence Awards program, and we are deeply grateful for their generosity. This video offers a brief glimpse of their genuine love and appreciation for nurses.
Believe it or not, you mean a lot to me personally. You mean a lot to each other. For you are, as far as I'm concerned, the veritable angels in this community. When a patient comes in, you don't know anything about him or her, and yet you reach out immediately to this individual with the same care, regard, generosity, and empathy we normally reserve for those closest to us. You have helped make the Cleveland Clinic into one of the greatest hospitals and institutions, not in America, not in the Western Hemisphere, but all over the world. Someday, after enough DNA tests, they will discover the gene in the nurse that makes you walking hearts, perennial consciences, and empathetic human beings. And when they do, They will look for this gene in all humanity, and we will have found the answer to peace and no more wars forever.
We begin tonight's awards presentation with the Samuel H. Miller Art of Nursing Award, presented in recognition of clinical nurses who promote and demonstrate compassion and empathy for patients, families, and colleagues.
The 2024 honorees are Fozia Adan, Cleveland Clinic, Abu Dhabi. Fozia works in the Cardiac Ambulatory Clinic in Abu Dhabi, where she has participated in numerous quality improvement programs and helped develop atrial fibrillation patient education materials in Arabic and English. She considers it a privilege to be part of a patient's healing journey.
Peyton Arnold, Cleveland Clinic main campus. During a nationwide job search, Peyton was amazed by the leukemia team at Cleveland Clinic main campus. She joined that unit 4 years ago and now co-chairs its shared governance committee. Peyton is passionate about caring for patients and building a rapport with them and their families during a challenging time in their lives.
Joshua Campbell, Cleveland Clinic, Marymount Hospital. Joshua is an assistant nurse manager on a medical surgical telemetry unit at Marymount Hospital. During his 5-year nursing career, he has co-created a wellness initiative for his colleagues, helped implement a new model of care, and participated in the Magnus Experience. Joshua strives to personalize care and connect with patients.
Todd Hammond, Cleveland Clinic, Akron General. Todd has been a clinical nurse on a medical surgical orthopedics unit at Akron General for 25 years. He is committed to making process improvements that enhance patient care and participated in the Delirium Interventions for Falls Reduction Project. Todd also serves as a clinical instructor through the University of Akron.
Sarah Hernandez, Cleveland Clinic, Medina Hospital. Sarah has been a clinical nurse and preceptor in the operating room at Medina Hospital's Park West Surgical Center for the past 8 years. She is a Magnet ambassador and co-chair of her unit's Shared Governance Council. Sarah is proud to be a part of an OR team that restores sight to patients.
Ashley Jones, Cleveland Clinic, Euclid Hospital. Ashley joined Euclid Hospital after graduating from nursing school 18 years ago. She currently works as an assistant nurse manager on a medical surgical unit and is a member of the PCNA Council and Unit-Based Council. Ashley is honored to care for patients in the community where she grew up.
Shaka Jones, Cleveland Clinic, Indian River Hospital. A 15-year nursing veteran, Shaka joined Indian River Hospital 8 years ago and now works in labor and delivery. She is a certified doula, certified lactation consultant, and childbirth educator. Shaka enjoys empowering new mothers and providing them with a solid foundation for parenthood.
Angie McDonald, Cleveland Clinic, Martin North Hospital. Angie joined Martin North Hospital 23 years ago and has worked as a clinical nurse in the cardiovascular ICU for the past 18 years, where she also serves as secretary of the Shared Governance Council. Angie loves being a bedside nurse and cherishes the camaraderie among her colleagues.
Callie Orlando, Ashtabula Regional Medical Center. Callie began her 12-year nursing career in a medical ICU at Cleveland Clinic main campus before moving to Ashtabula Regional Medical Center as a clinical nurse in the emergency department. She is committed to providing compassionate patient care and is grateful to work alongside an extraordinary team of caregivers in the emergency department.
Stephanie Petrick, Cleveland Clinic, Fairview Hospital. Stephanie spent 8 years working in a medical ICU at Fairview Hospital before transitioning 3 years ago to the post-anesthesia care unit, where she chairs the Shared Governance Council. Stephanie thrives on the fast-paced environment in the PACU, continually learning about new procedures and care of the post-operative patient.
Christopher Rydell, Cleveland Clinic main campus. Christopher joined the colorectal surgery unit at Cleveland Clinic main campus 5 years ago and now serves as an assistant nurse manager, discharge navigator, and a member of the sepsis surgical emergency response team. He is grateful for the opportunities within Cleveland Clinic to grow both his nursing and leadership skills.
Ashley Rockowich, Cleveland Clinic Lutheran Hospital. Ashley is an assistant nurse manager on a medical surgical telemetry unit at Lutheran Hospital. She is a skincare resource nurse, Magnet ambassador, and shared governance member. Ashley loves caring for the diverse patient population at Lutheran, where she feels like she can truly make an impact in her community.
Katie Rodriguez, Cleveland Clinic Weston Hospital. Katie began her 33-year career as a medical assistant in small offices, then transitioned to Weston Hospital 20 years ago. For the past 6 years, she has been a clinical nurse in concierge medicine. She feels honored to participate in the patient's healthcare journey and cherishes her meaningful connections with patients and their families.
Katie Rose, Cleveland Clinic South Point Hospital. Over the past 12 years, Katie has worked in numerous critical care settings. A year ago, she became a clinical nurse with the Adult Medical Emergency Team at South Point Hospital. Katie loves her job because she can comfort patients and families, as well as teach nurses how to problem solve and work through critical situations.
Jamil Jimmy Shaheen, Cleveland Clinic Main Campus. Jimmy is a clinical nurse in the Cardiac Step-Down Unit at Main Campus. He is a member of the CNO Roundtable, the Float Process Improvement Work Group, and the CNO Safety and Wellness Work Group. Jimmy is proud to work at Cleveland Clinic, which he calls the best place in the world to provide health care.
Sally C. Tomko, Cleveland Clinic Avon Hospital. Sally has spent her entire 41-year nursing career at Cleveland Clinic. 8 years ago, she joined Avon Hospital's post-anesthesia care unit as a charge nurse. Sally was a member of the Magnet Committee, Safety Committee, and Shared Governance, and has participated in several poster presentations. She treasures her career at Cleveland Clinic and the many patients she has helped.
Stephanie Welch, Cleveland Clinic Main Campus. Stephanie loved her rotation in the neurological ICU at Cleveland Clinic Main Campus. So much, she joined the unit after graduation nearly 30 years ago. She is currently a unit-based skincare nurse and wellness champion. Stephanie is proud of mentoring caregivers to provide quality care for patients while also supporting one another.
Kirsty Wyatt, Cleveland Clinic, London. As lead clinical nurse specialist in the Digestive Disease and Integrated Surgery Institute at Cleveland Clinic, London, Kirsty has continued her 20-year career with the goal of improving the quality of life for women. She is actively involved in several leadership programs and developed an education day for urogynecology clinical nurse specialists that is now a course at the Royal College of Nursing.
Congratulations to all our Samuel H. Miller Art of Nursing Award recipients. Your compassion and empathy are a true testament to putting patients first.
Our professional practice model helps nurses throughout the enterprise understand what we stand for, what's important to us, and where our goals are over time.
It's the roadmap. It's our values in action.
All of these pieces come together and help our nurses be the very best they can be.
This model isn't just a guide to what we do, it's who we are.
Quality and safety is absolutely essential. Not only is it best for our patients, but it really fills our cup as well to know that we're able to provide this type of care. We like to guide nursing practice, so we write policies, guidelines, in what we know is best. That's one of the things that makes me most proud to be a caregiver here, is that you're supported to make sure our patients remain safe and our fellow caregivers remain safe.
A relationship-based culture guides so much of our work, because at the core of everything we do, we need connections with people. It takes our very clinical and fast-paced environments and makes it more human. It allows us as clinicians to really connect with one another, our patients, and ultimately our community. We have such a unique privilege of opening our hands to people at their most vulnerable times. When we work together, grounded in this culture of compassion for one another and for our patients, it really helps elevate all of our outcomes.
Professional practice is what nurses bring to our practice. Their skills, their talents, their abilities, their expertise. Professional development builds on that, and it starts the very first day that a nurse joins the Cleveland Clinic. There is a path for courses and leadership and opportunities to learn and grow and constantly develop. This helps nurses practice at the top of their license with their expertise and ultimately to have the best outcomes for the patient. It is really the epitome of lifelong learning.
We want nurses to participate in research, evidence-based practice, or innovation. Every nurse should be thinking creatively, should be thinking about what are those issues, those problems that they encounter day in and day out, and they should be sharing that with us so that we can help them be part of the solutions. We want to set that tone. We want to be the movers and shakers who figure out that something needs to change, and then we want to share it with the rest of the world so we can help others in the nursing profession do better for our patients.
One of the greatest pieces about the professional practice model here at the Cleveland Clinic is that it is ours. It was developed by our nurses. Everybody comes wanting to do their very best, and this professional practice model supports them in doing that.
It's important for every nurse to raise their voice because that's how we make change happen. That's how we become better.
It's what connects us back to the core of why we went into nursing in the first place.
We are the largest group of caregivers within the organization, which makes us a very strong force and really puts us in such a great position to lead.
There's no greater place to be a nurse.
The Professional Practice Model Award for Quality and Safety is presented in recognition of nurses providing safe care where patients and caregivers achieve high-quality outcomes. The 2024 honorees are
Albert C. Bargamento, Cleveland Clinic, Abu Dhabi. Albert joined Cleveland Clinic, Abu Dhabi 6 years ago and currently works as a senior nurse in the Pain Management Clinic. He led a project to standardize post-procedure phone call protocols and is an auditor for the Patient Identification Audits Initiative in the Neurology and Pain Management Clinics. Albert says nursing is a calling that fills him with a profound sense of fulfillment.
Stacy Holt, Cleveland Clinic Main Campus. Stacy is a clinical nurse in the Acute Pain Management Service at Main Campus. She has served as a patient safety champion and presented on regional anesthesia at the American Society of Pain Management Nursing's National Conference in 2019. Stacy finds it rewarding to see the difference that regional anesthesia procedures make for patients.
Thank you, Albert and Stacy, for your unwavering dedication to quality and safety.
The Professional Practice Model Award for Relationship-Based Culture is presented in recognition of the skills, talents, expertise, commitment, and personal attributes of a nurse dedicated to promoting strong relationships with patients, families, fellow caregivers, and the community. The 2024 honorees are
Carrie Coppola, Cleveland Clinic, Martin South Hospital. Carrie has been the orthopedic program coordinator at Martin South Hospital for 9 years. She has published several best practice guidelines for the National Association of Orthopedic Nurses and sits on its Congress Planning Committee. She enjoys working on process improvement projects, educating patients and nurses, and collaborating with interdisciplinary teams.
Mackenzie M. Straub, Cleveland Clinic, Indian River Hospital. Mackenzie joined Indian River Hospital's Ambulatory Neuroscience Department a year and a half ago and now serves as ambulatory team lead. She is a member of the Group of Aspiring Leaders, the Nursing Research and Evidence-Based Practice Committee, and the Joint Commission Task Force.
Thank you, Carrie and Mackenzie, for your commitment to all the patients you serve.
The Professional Practice Model Award for Professional Practice and Development is presented in recognition of embracing lifelong learning and continuous professional growth to advance the professional practice of nursing. The 2024 honorees are
Sadie M. Dice, Cleveland Clinic, Weston Hospital. A 30-year nursing veteran, Sadie is an assistant nurse manager on the Telemetry Stroke Epilepsy Unit at Weston Hospital. She is also an adjunct professor at a local nursing college and a member of the Cleveland Clinic Research Council. Last year, Sadie published an article in the online Journal of Issues in Nursing and continues to be an inspiration to others for her commitment to lifelong learning.
Lynn Cocosta, Cleveland Clinic Main Campus. A nurse of 17 years, Lynn has worked as a clinical nurse specialist on a medical ICU at main campus for 6 years. She co-chairs the Intensive Care Unit Practice Council and has authored numerous journal articles, most recently publishing results from a study on peripheral administration of neuroepinephrine. Lynn is committed to educating and empowering nurses.
Thank you, Sadie and Lynn, for your dedication to professional practice and development.
The Professional Practice Model Award for Research, Evidence-Based Practice and Innovation is presented in recognition of evidence-based clinical practice and management through research and innovation, which transforms healthcare to provide the best outcome for patients. The 2024 honorees are
Brian Coyle, Cleveland Clinic Lutheran Hospital. A 12-year nursing veteran, Brian is an assistant nurse manager in the operating room at Lutheran Hospital. He has contributed to numerous practice improvements and is principal investigator on an ongoing research project focused on OR staff breaks and the potential for increased infection risk for total joint replacement patients.
Shinjiro Shirakawa, Cleveland Clinic, Abu Dhabi. Shinjiro joined Cleveland Clinic Abu Dhabi as part of the Heart, Vascular, and Thoracic Institute's Expanding Robotics program. He is a clinical nurse in the operating room, where he is helping implement an evidence-based training program for robotic surgery. He loves the patient and caregiver diversity at the hospital and thrives on being at the forefront of medical innovation.
Thank you, Brian and Shinjiro, for leading by example in promoting evidence-based practice and innovation.
Congratulations to all of our 2024 Professional Practice Model Award recipients.
When we think about healthcare and the work that our nurses do, it's hard to imagine a role more closely tied to what the patient experiences. Our nurses see opportunities to make things better every single day. Nate Hurl loved making things better, but he wasn't somebody who felt the need to do it himself. He loved making things better through other people. I don't know of an individual who's been more impactful outside of the Nursing Institute to the way nurses think and practice than Nate. And I can't imagine a better way to honor Nate's memory than to memorialize him in this award. The work that Nate did, either himself or through our continuous improvement team, really empowered nursing to do what they always wanted to do anyway, which is make the care better for patients. And my hope is that others remember that commitment to improvement, and really I would say a commitment to each other in their own work. We really have an opportunity to magnify the impact of the work we can do, the impact of our skills, of our passion for making things better, when we can ignite that same passion and spark in other caregivers. So my hope is that the recipient of the Nathan Hurl Award really sees herself or himself as not just an improver, but really an agent of change to affect spreading this culture and fostering improvement everywhere.
The Nathan Hurl Award for Continuous Improvement in Nursing is presented in recognition of excellence and commitment to the pursuit of process improvement through continuous innovation. The recipient of this award demonstrates the key attributes of integrity, respect, teamwork, accountability, and drive to improve. The 2024 honoree is
Erica Murata, Cleveland Clinic, Hillcrest Hospital. Erica is a clinical nurse and continuous improvement champion in the Medical Surgical Oncology Unit at Hillcrest Hospital, where she led an initiative to create a new supply stocking system that decreased wasted supplies and saved money and caregiver time.
Thank you, Erica, for your commitment to improving care for patients, and congratulations on being this year's Nathan Hurl Continuous Improvement Award recipient.
The Nancy M. Albert Nursing Research Excellence Award is presented in recognition of excellence in nursing research for demonstrating the importance of raising awareness of the value of evidence-based practices. This honoree encourages fellow nurses to think innovatively, develop, conduct, and disseminate research findings, and ultimately translate those findings into practice. The 2024 honoree is
Maya Shamailov, Cleveland Clinic main campus. Maya works as a clinical nurse specialist in the Imaging Institute. She has conducted research and presented at conferences on numerous topics, including call light responsiveness, decreasing central line infections, predictors of difficult peripheral vascular access, and more.
Congratulations to Maya, this year's Nancy M. Albert Nursing Research Excellence Award recipient. Thank you for your service and commitment to Cleveland Clinic.
Our next award of the evening, the Carolyn Neiman Advanced Practice Registered Nurse Excellence Award, is presented in recognition of excellence in clinical care, support, and promotion of the APRN role and interdisciplinary collaboration. The 2024 honorees are
Sarah Fichter, Cleveland Clinic Mercy Hospital. Sarah has spent her entire 13-year nursing career at Mercy Hospital. Since 2019, she has worked as an APRN in the pre-anesthesia consultation clinic, leading a team that prepares patients for upcoming surgeries and improves surgical outcomes. Sarah is a member of Nurses Improving Care for Health System Elders and the enterprise-wide APRN Committee and Legislative Subcommittee.
Colleen McEwen, Cleveland Clinic Fairview Hospital. Colleen was appointed Clinical Coordinator for the West Submarket, overseeing Fairview Hospital's medical ICU and the Kemper Coronary Care Center. She assisted in rolling out the Sepsis Early Response Team and the Critical Care Advanced Practice Fellowship Program. Colleen is proud to help lead Cleveland Clinic's growing advanced practice provider team and serve as an educator and mentor.
Congratulations to Sarah and Colleen, this year's Carolyn Neiman APRN Excellence Award recipients. Thank you for your service and commitment to Cleveland Clinic.
Hello, I hope you are all enjoying our ceremony so far. Our 2024 honorees are truly inspiring. As we hear their stories, we are reminded that they were called to this line of work. Being a nurse is who they are today, and it's who they've always been. At Cleveland Clinic, we consider it a priority to care for patients like they are members of our own families. The nurses that we celebrate next embody this concept completely, demonstrating superior patient-centered care every day. They are the recipients of the coveted Lifetime Achievement Award, and together, they have a combined total of more than 400 years of nursing experience. This award represents a profound level of commitment to the nursing profession. It is given in recognition of a nurse's significant accomplishments in advancing nursing practice, improving patient outcomes, enhancing work environments, and promoting multidisciplinary teamwork. As we recognize this year's honorees, you will have the opportunity to hear their personal reflections on what it means to them to be a nurse and a member of the Cleveland Clinic family. I am honored to present to you our 2024 Lifetime Achievement Award recipients.
We begin with the first four 2024 Lifetime Achievement Award honorees. Jen Arman, 22-year nursing career, Cleveland Clinic Mercy Hospital. Jen has spent her nursing career as a clinical nurse in the coronary care unit at Mercy Hospital, where she serves on the Unit Practice Council, Mercy Hospital Professional Council, and the Retention and Recruitment Committee. She is committed to aligning patient care with best practices and cherishes the opportunity to learn something new every day. As a preceptor and mentor, Jen encourages other caregivers to embrace change and continue to learn.
My first day here at Mercy, she was my first preceptor that day. Just kind of put me, right in the center of things and said, let's go, let's do this. She's a great critical care nurse and always has a questioning attitude.
Mary Campbell Smith, 35-year nursing career, Cleveland Clinic Martin North Hospital. Mary has served as nursing operations manager at Martin North Hospital for the past 12 years. She advocates for patients and encourages collaboration between nurses and physician providers. Mary holds herself and her colleagues to a high standard and inspires others to do the same. She is a resource, mentor, and role model for nurse caregivers throughout the hospital.
She's passionate about teaching and ensuring the future of nurses. That's just Mary. She continues to help you grow even 15 years later. She's still my go-to.
Jean Henry, 42-year nursing career, Cleveland Clinic. Jean is dedicated to educating nurses During her career, she has developed numerous educational programs for caregivers throughout the Cleveland Clinic enterprise, including a 6-week program to support the opening of Mentor Hospital. She also leads the Nurse Associate Extern program. Jean loves her role as an education manager because it impacts so many caregivers and patients every day.
She's compassionate. She is patient first. She understands education principles, and when she puts in education into place at each hospital, it's for the nurses and for the betterment of our patients.
Karen M. Hooven, 44-year nursing career, Cleveland Clinic, Medina Hospital. As manager of the Care Management Department at Medina Hospital for the past 8 years, Karen has led several hospital-wide initiatives, including ones to decrease length of stay and raise awareness of the value of case management through process improvement. Karen is co-founder and current president of the Cleveland chapter of the Case Management Society of America. She believes in the team of teams approach and is respected by colleagues and hospital leaders.
Karen is the quintessential nurse. She really has been the catalyst for us to bring teams together to make improvements for our patients. Her innovation, her tireless efforts have just been tremendous, and she's highly regarded by all of our team members.
Now that I have been a nurse, I honestly could not see myself doing any other career.
Doesn't matter where your family takes you, where your life takes you, you're always a nurse, and there's a different type of nursing for every single person.
Nursing has changed over the years, but even with all the changes, it comes back to the patient. It comes back to the person at the bedside taking care of the patient.
They literally have the patient's health in their hand because they're the eyes for the doctor. And to be able to recognize when someone's not doing well, you know, that's a great responsibility.
You're not only taking care of your patient, a lot of times you do develop a relationship with the family members. You're supporting them, you're helping them.
And it doesn't matter whether it's the newest caregiver or the individual who comes to us with 40 years of experience, showing them why we do it different and that we focus on our patients first and evidence-based practice, and that's why we make a difference. That's what gets me back.
The patient's happy, the family's happy, and we know we've done a good job. So it's very special.
Nurses are a rare breed of people. There's no one else like a nurse because your whole heart is surrounded with that passion and compassion that you have for people.
The next 3 2024 Lifetime Achievement Award honorees are Kimberly Kitchell, 41-year nursing career, Cleveland Clinic East Submarket. Kimberly has been a part of many advances in medicine and nursing during her career. She currently serves as a care coordinator for orthopedic surgery at Cleveland Clinic's East Submarket. Peers praise her commitment to innovation, continuous learning, and proactive problem solving. Kimberly says the best part of her job is the ability to connect with people, share knowledge, and advocate for patients to provide a positive experience and quality outcomes.
Kim is the most caring, loving nurse that anyone would want to have, ever. She is a lifeline for all of our patients. She never is without a kind word for somebody, always, no matter what.
Prosina C. Palacios, 26-year nursing career, Cleveland Clinic, Abu Dhabi. As a clinical nurse in the post-anesthesia care unit, Prosina is respected by her peers and leaders at Cleveland Clinic, Abu Dhabi for her unwavering commitment to patient care and safety. She audits hand hygiene practices, reviews PACU protocols, and leads the Pain Reassessment Task Force and Patient Privacy Project. This nursing veteran won the Empathy Value Award in 2022 and consistently elevates nursing standards.
Prosina has an absolute wealth of knowledge from her extensive career in nursing, and she brings that to work every day. She's coaching junior caregivers, she's constantly talking about her experience, and her clinical expertise are next level. She's a fantastic nurse.
Maria Rosnick, 42-year nursing career, Cleveland Clinic. Maria retired in March. As a nursing professional development specialist for the past 14 years, she helped lead the opening and onboarding of caregivers at Cleveland Clinic Mentor Hospital and developed a paramedic upskilling program. She has presented at several conferences and published an article in the Journal of Nursing Professional Development. She truly pioneered the nursing professional development specialist position at Cleveland Clinic and has mentored and influenced the next generation of nurses.
Maria is someone who, she's meant to be a nurse. More importantly, she's meant to be a nurse educator. She's passionate. She really prioritizes doing it right. Not just getting it right, but doing it right the first time.
Nurses are the heartbeat of the Cleveland Clinic. We're there to advocate, we're a shoulder to cry on, we're information, we're educators.
You're always communicating, you're always making sure that all the T's are crossed and I's are dotted. So it's just constantly orchestrating that journey of that patient.
My inspiration working here in Cleveland Clinic, Abu Dhabi, is teamwork. Working with other nationals in different practice, but we align in one common goal, which is to provide a safe care to our patients.
Yes, we are a very large organization, but the people where you work are the pride of the Cleveland Clinic, and they make people want to come here and get care. And that's a big part of what our role is, and that's why nurses are so vital to the mission of the Cleveland Clinic.
I truly feel that nursing is a calling. You come in and you put your 8-12 hours a day in, and you turn around and you come back and you do it all over again. New set of faces, new set of problems, but it's a good feeling.
From the moment that they step in the hospital until their discharge, we nurses are the core of their everyday life.
They might not remember your name, but they remember that they were cared for. So nursing really embodies the whole experience for the patient.
I'm excited to see where nursing is going to go. I mean, between shared governance and magnet status and certifications, the reach is endless for nursing, it really is.
The final four 2024 Lifetime Achievement Award honorees are
Mary Ellen Selly, 42-year nursing career, Cleveland Clinic, Akron General. Mary Ellen became intrigued with the operating room as a nursing student. Since earning her nursing diploma, she has spent most of her career as a circulator and scrub nurse in the operating room at Cleveland Clinic, Akron General within the neurosurgery service line. Her contributions to the advancement of neurosurgical nursing practice have left an indelible mark on the department.
She loved to teach. Very knowledgeable, was always up to date on the latest information, the newest medications, anything that came along. She always seemed to capture that skill and had that knowledge and was always readily available.
Jennifer Yeckley, 33-year nursing career, Cleveland Clinic. During Jennifer's nursing career, she has cared for patients from Northeast Ohio to the Middle East. After working for Cleveland Clinic Home Care, she traveled to Cleveland Clinic Abu Dhabi in 2014 to help establish its wound and ostomy program. Jennifer returned to the U.S. in 2023 and now serves as West District Assistant Nurse Manager for Cleveland Clinic's Center for Connected Care.
She is great with education within our team. Her patients, you see her face light up when she starts talking about what she's done over in Abu Dhabi, what she's brought to our team. She is inspirational, she's innovative, she's the epitome of what it means to be a nurse.
Sherry Zimmerman, 39-year nursing career, Cleveland Clinic Mercy Hospital. Sherry began her career in 1985 as a float nurse, where she found her passion for critical care nursing. She has been a clinical nurse in the ICU at Cleveland Clinic Mercy Hospital for 36 years. During that time, her knowledge, experience, and critical thinking skills have influenced positive outcomes for countless patients. Sherry feels honored to take care of patients and families facing the most vulnerable times of their lives.
Sherry brings to her practice a standard of nursing excellence that is top quality. She teaches. She actually brings her students to our clinical unit, and we can see the kind of quality that she's instilling in the future generation of nurses.
Barbara Zinner, 40-year nursing career, Cleveland Clinic, Marymount Hospital. Barbara has spent 29 years of her nursing career at Marymount Hospital. For the past 12 years, she has served as their Chief Nursing Officer. Under her leadership, Marymount Hospital received Magnet designation and launched a new model of care delivery, leveraging the skills of patient care nursing assistants on medical surgical units. Barbara is dedicated to improving patient outcomes and advancing the nursing profession and practice through education, research, and shared decision-making.
Barbara is a force to be reckoned with, and I say that in the most positive way. She shoots for the stars every single day in her leadership abilities, and she promotes all of her nursing leadership and nurses here at Marymount to do the same.
Nursing, you have so many opportunities. You can go into management, you can go into home health care, you can do anything. You can travel the world.
I had the opportunity to be educated by Cleveland Clinic to become a WOCN, a wound and ostomy nurse. And I took on that role and absolutely loved it. Then when the flyers came out that Abu Dhabi was opening up, I was given that opportunity. And so off I went to Abu Dhabi for 8 years.
I spend most of my days in neurosurgery, either doing brains or spines. Every day is something different. There's so many different services. There's so much to see and so much to learn.
And I encourage any nurse to continue to grow and learn. If you really found your passion, stay in that area. But if you haven't, keep looking, because there's so many possibilities.
Most of my time now is spent teaching the new nurses. Nurses are the ones who are the quarterback of the team, in my opinion. And that's why you gotta know front to back what you're doing.
For all leaders and nurses that are caring for our patients, they are the leader of their patient population. They are the leader that the patients are relying on.
It's just part of who the Cleveland Clinic nurses are. We're leaders and we're team members and we're all together. You know, everybody's in it.
This is my job, this is my passion, to be part of the team that gives quality care to our patients that come here and trust in the care that we will provide for them.
Congratulations to all of our Lifetime Achievement Award recipients, and thank you for your astonishing combined 406 years of service in nursing.
It's a treasured gift to have the life of another human in your hands, and it's a gift that gives indefinitely. Nurses remember their patients and their families, and patients and families remember their nurses. Dr. Hancock mentioned Cleveland Clinic's aim to care for patients like family. As caregivers, we also aspire to treat each other the same way. I'd like to turn your attention now to a heartfelt story about the crossing paths of two Cleveland Clinic nurses.
I'm Pamela Kays, and I'm a nurse in M31, which is neonatal intensive care. I love bonding with the parents. They're going through one of the hardest times in their lives, and it's just so rewarding. Monday morning, October 2nd, I am walking into work. I get into the unit, and I started to feel very unwell. My jaw was clenching, like really, really tight. And then I got this severe heaviness in my chest, and I knew that I was having a heart attack. I was pulseless 3 times.
My name's Allison Hoyt. I work in J31 as a nurse practitioner at the coronary intensive care unit. I remember that it was a Monday. My co-nurse practitioner was talking about Pam. Both of us got chills because she's one of us, she's a nurse. It hits home in a different way. And I went to go assess her.
I started to get a little panicky, and she said, Pam, we're gonna take good care of you, and we're gonna get you comfortable, and you don't have to worry.
And I leaned over and I was like, I'm sure you're scared. I know you're scared, but everything's gonna be okay.
And just hearing her speak to me, I knew I was in really great hands. Allison took care of me, and she's part of the reason that I'm still here.
When I went to go check on her on Wednesday, she was already up on the regular nursing floor. I never thought I'd see her again.
Baby Maddie was transferred from Hillcrest to main campus. I was sitting talking to the grandmother, and she, is telling me how her daughter is a nurse practitioner on J31. I said, wow, I was a patient on J31 in October. And next thing I know, Allison walks around the corner.
I was like, oh my God, you were the nurse that arrested during report. And she was like, that's me. And I was just kind of already very hyper emotional. I got the chills and I think I said, can I give you a hug? But it felt kind of crazy to have someone take care of my baby, who I took care of.
I actually became Maddie's primary so that I could take care of Maddie every time that I worked. And I was so thankful to be able to pay it back to Allison and pay it forward to Maddie.
It felt really good when I couldn't be there with the baby, that there were people there that were caring for her as if she was one of their own. It ended up I stayed 70 days. I don't know if she would be here if we didn't have the right people looking out for her. We're very grateful.
I don't know everything there is to know about adult nursing, and Allison didn't know everything there was to know about NICU nursing, and we recognized that we each have our specialties, so we felt confidence in each other.
And to have someone who knows maybe not exactly what you're going through, but pretty close to home is very comforting and incredible.
What a wonderful story and testament to the incredible impact nurses have on the lives of others. This has been an amazing celebration. I am personally inspired by each of our 2024 Nursing Excellence Awards recipients. Congratulations once again on your well-deserved honor. And thank you to the friends, families, and colleagues who joined our ceremony. We are so happy you could share this experience with the very special nurse in your life. Thanks also to our planning committee and production team and everyone who helped organize and execute this program. You are appreciated. And finally, to Dr. Tom Mihaljevic and Dr. Kelly Hancock, we could not ask for better leaders. Thank you for taking the time to celebrate our nurses. This concludes our ceremony. I wish you all the best and thank you again for joining us.
This has been the 2024 Maria and Sam Miller Nursing Excellence Award Ceremony. Thank you for watching, and congratulations to all of tonight's remarkable honorees.